So today we're going to talk about 6 symptoms of bone-on-bone hip arthritis. Now, I've created this list, and the list at the very beginning, at the top of the list, are the things that if you notice these symptoms, definitely get in with a physical therapist because they're going to be able to help you prolong from not having to have surgery. That the significance of you having surgery will go down if you get into someone with physical therapy that understands the hip when we talk about the list at the very beginning. When we get to the bottom of the list, the likelihood of you having surgery goes up significantly. So we're going to take this kind of step by step. So let's go with number 1, hip stiffness. When you feel hip stiffness, it can be stiffness in the front of the hip. It'll feel stiff like if you've been sitting for a while and then you stand up. It just takes you a while to kind of straighten up because it's very stiff. If you've been lying down and you start to move, that kind of thing, when we hear stiffness is the first sign of something's going on, usually within the joint. Not always, but usually within the joint. And we always tell our clients that if you can improve the stiffness, like if you can improve that mobility by just a little bit, the significance of that in your life is huge because the more that we can move, the less protection that you'll have with your muscles, the more ability that you'll have to start strengthening those muscles to protect that joint in the correct way. Because if you can't move into a position, if I can't move my hip back, I'm not going to be able to get these muscles in the back of my hip to fire because you just physically can't move to be able to get them to fire. So if you're noticing stiffness, definitely get in with a physical therapist because they're going to be able to help you manage this a lot better and a lot quicker. Now, number 2 is weakness. If you have weakness and imbalances within that hip, what ends up happening is if you're stronger in the front part of the hip and weaker in the back part of the hip, you could literally be shifting the way that joint sucks up into that joint. And so if you're using more of the front of those muscles, you're going to get a lot more rubbing and problems in the front of that hip versus having the balance of the front muscles and the back muscles and the side muscles working together to kind of keep everything aligned the way it's supposed to be aligned. And so when you have these imbalances, this can cause problems down the road. So if you can get some of these things fixed, then definitely get them fixed. Now, with that being said, we've seen many clients come through our office where they went to physical therapy and like, I've been doing the hip exercises and I can't get them to fire. Nothing is working. And that's where a lot of times people miss that first phase of physical therapy, which is the mobility phase. How do the joints move? Not only joint in the hip, how do the joints move in the back? How do the joints move in the knee? Because they all affect each other. And if something's not moving, then you're going to have a hard time getting all the muscles to fire correctly. So if you notice that's happening, then you need to get to someone that's really going to be looking at your mobility first. But those first 2 things that we just listed, stiffness and weakness, a lot of times if we can get those corrected and teach you how to keep them that way, then the likelihood of you having a surgery is just going to go down significantly. You're going to be able to prolong this for a really long time. Okay, number 3, pain in the front of the hip. Now, when you start, when you have issues in the hip joint, it typically refers in the crease of that hip. And if we can, there's other areas of the body that can also refer into there, and there's other things that we can do that can reduce the pain in the front of the hip. But if it's truly coming from the joint, a lot of times we can't make changes. We can make a little bit of changes, but not significant changes, and that just gives us a telltale sign that you're probably going to need to have a surgery at some point. But a lot of times there's other things that can refer into that area. So getting into someone that really understands the hip and how it all works and how it's connected to the back and the knee and all those things, then you can get some pretty significant results of getting this to reduce. But sometimes when there's just nothing that we do and you're just always having the pain, that's when we're like, you're probably going to have a hip surgery. So the next one is a loss of range of motion. Anytime we're getting some arthritis in the joint, we tend to get a loss of range of motion. And where we see it the most if it really truly is arthritis, it's going to be that rotation. So how that leg rotates through here, you're going to lose that first before you're going to lose the bending forward and the bending backwards. And so you want to make sure, if that's the case, again, if we can improve that mobility even just a little bit, it increases your function significantly, even if you have some arthritic changes. We've had clients that have come in our office with clearly hip arthritis, because I'm like, this joint just does not move. But we were able to improve the range of motion and flexion extension, which then allows her to fire those muscles a little bit better. And we're able to improve a little bit of the rotation. Now that was the one that was the most limiting factor. We knew that she had some bony changes, because it just felt like there was no give, like we were blocking up against a wall. That's kind of what it feels like when there's a lot of bony changes within the joint. But we've been able to get her to stay active. She's still walking 5 miles a day and not really having too much soreness because of the things that we've been able to show her how to do. Now, there's other conditions that can mimic that arthritic change or that loss of motion, and you can improve that motion like that. And so if we're noticing some of those, it's really good to come into someone that understands the body, because a lot of times we can make some significant changes in that range of motion in that joint. And when we can do that, it protects the joint. It makes that joint last a lot longer. Now, number 5, it's difficulty with weight bearing. So when you start getting pain in the front of that hip with weight bearing, putting your feet on the ground, walking, those kind of things, or you feel it deep in the hip, those are again signs that you might have some arthritis, some bone-on-bone arthritis in that hip. And now again, if we can improve the range of motion and we can improve the strength, a lot of times we can prolong the likelihood of you having to have a total hip replacement. It is definitely worth it. Worst case scenario, we can prolong you. You're stronger than you were when you started, that if you do eventually have that hip replacement, that hip is already starting at a strong place. It's already starting with better mobility than you would have had if you just went ahead and had the surgery. So there's still things that we can do. Now, number 6, when you have noise in the joint, it's like a grinding feeling or clicking on the inside. This is a sign that you definitely have arthritis. Rarely can we help people that has that grinding in that joint. Rarely have we been able to help people not have surgery. They usually have to have surgery. Now, we do have new technology that's called focused shockwave, which helps with arthritis in the bone. When we have arthritis in the bone, it means there's just a lack of blood supply in those areas, and this helps stimulate that blood supply into those areas that are damaged, as well as improving stem cell and growth factors to really make that bone feel young again. So if you have something in the beginning stages of it, the earlier that we can catch it, the likelihood of you prolonging you having surgery using shockwave is huge. So if you know anyone that's having some of these signs, definitely send them to our office, because we're one of the few offices in the DFW area, the Dallas-Fort Worth area, that has this technology, and we might be able to prolong it. The results that we get are pretty fantastic, and usually it's about 6 visits, and that's it for that treatment session of that hip joint. So those are the 6 signs that you have some bone-on-bone hip arthritis, and how you can start making adjustments today so that you can get back to feeling better and prolonging you the likelihood of having to have that surgery. The longer we can prolong it, and while you're able to still live your life, the better it's going to be. So make sure that you get to someone that can help you if you have any of these symptoms. Again, my name is Stephanie. I'm with Empower Physical Therapy. We help clients avoid surgery, injections, and medications while getting their life back. We help you put the pieces of the puzzle together, and we have a lot of new technology to help us help you avoid that surgery. So if you know anyone that is interested in this, make sure you share this video, like this video, have comments down below, and where you can ask some questions. We'll definitely answer them and get to those, as well as there's other resources in the description for things that you can continue your learning on this area.